Welcome to the Real Integrative Medicine podcast. I'm Dr. Jordan Robertson, and I'm here to bring you the tools, insights, and strategies to take your health to the next level while using evidence-based integrative medicine. What's real? This is what we want to explore together. Research is ever-changing and not easy to interpret. We're bringing you the best that integrative medicine has to offer while sticking to the facts. Our mission is to elevate the practice of integrative medicine for clinicians and patients alike. Preventative solutions, nutrition, exercise, and sometimes supplements have a seat at the table in medicine, but only if we uncover real science-backed solutions. It's time to uncover what works and challenge what doesn't. Let's unlock your full health potential with an integrated approach. Ready to learn what's real? Let's dive in. Welcome to another episode of Real Integrative Medicine. I'm Dr. Jordan Robertson. I'm a naturopathic doctor. My primary role right now is actually to support naturopathic doctors in supporting their patients. Today's discussion is going to be about something that I find absolutely vital to have included as part of your health plan. If you're a practitioner listening, this is going to give you great intel for how to be more directive around supporting patients in terms of their thought process about their health journey. And if you are a sort of health seeker that is listening, this is going to be an important episode regardless of what you are currently working on right now, whether your health goals are metabolic, whether they are skin related, whether it's performance and exercise related. This is a really important concept that I don't think we spend enough time on. And if we focus on it, and I'll explain what the topic for the day is in a second, it actually helps create this idea of forward momentum and growth inside your health plan. So we're talking about the idea of reflection and attribution. I have found over my, sort of long career that when we look at other areas where goal-oriented behavior is really celebrated and is really, I'm going to say intentional, right? We often will see very intentional goal-related behavior in athletics. We will also see intentional goal-related behavior in our work, right? Or in business where there is a goal, it is like out in front of us, and we have identified actions, behaviors, outcomes that are related to achieving that goal, right? No athlete wakes up if they've been 10th in the world in their sport. They don't just randomly get to wake up and be first, right? There would be a process that they would move through to become first one day. And even if we're not particularly familiar with the sport, right? Like if I don't really know a lot about shot put, but if you were 10th in the world, I imagine that if you wanted to be first, there would be certain like activities and behaviors that you would have to do in order to get there. We can also easily identify those things in our work, right? If you want a raise in your work, if you are looking at having a project be successful, there are these like actions and behaviors that you have to do methodically, right? You don't just haphazardly do work and a project comes together. You don't haphazardly do exercise and you're first in the world. There is a process that you move through. And quite often we don't have that process intentionally embedded in how we think about someone's health journey. And I think this is what always made me successful at working with patients is that my personal skill set is in like project management, see 9,000 data points and know like which 3 levers need to be pulled. That's my skill set. And being able to be very clear about what that is, be able to communicate that really effectively to patients, I think is vital. And as a clinician, if you're listening, you're going to want to listen for and pick up on some of these pieces because this is what gets your patient to commit, mentally and maybe physically to the outcomes that you're trying to achieve together. So if we can get like incredibly clear about the process that they have to go through in order for them to be successful. But we're talking today about reflection and attribution. And I'm the first person to agree that, sort of this like digging into your past and digging into, your previous traumas is probably not the right way to propel yourself forward. So when I'm talking about reflection, I'm not talking about, going back into your, worst moments and reflecting on that to see how it brought you to where you are today. It's this idea that if we never reflect on what is happening or what has happened sort of day to day, as we move forward, it's with much less intention. We've not drawn our attention and focus towards maybe the things that are required of us to hit our goal. And we have a hard time linking up the things that are happening to the outcomes that we are achieving. Right? If going to the gym one time made you first in the world, we would not have a motivation problem, right? We would not have a commitment problem to our health goals if we felt great every single time we did something positive for ourselves. And we've talked about this on the podcast before around like, how do we build healthy habits? How do we create a connection between the things that we're doing and the outcome that we're looking for? And one of the pieces that must be part of your journey, whether it's health related, whether it's business related, is to have this intentional practice of reflection. And I'm going to use the word, which we often use in sort of the tech world, but it's attribution. So when I was an undergraduate student, I was part of a very unique undergraduate experience at McMaster University. And I remember, in my first year, they put us through these like sort of bonkers social experiment type exercises where we had to interact with each other. They were all these sort of like, they were kind of like games, but they were intended to create discomfort and uncertainty, right? We had, build things without all the materials we needed. We needed to communicate with each other, but we were given these rules around what you could and could not say. And so it basically took away some of the very basic communication frameworks that we would use. And as first year students, it was this like sort of brain gymnastics to figure out, well, if we get rid of some of the commonalities between the way we communicate with other people, what happens, right? It was like total meltdown in communication. So we had to do these exercises, and it was to support us in being, different and diagonal thinkers around problems, to be innovative with problem solving. But they didn't just put us through the exercises, right? We would have to do these things. I recall one really specifically where we like walked around the room and the things we were allowed to say to each other like literally made no sense. And yet we had to try and like have a business exchange, but we weren't allowed to basically speak the same language to each other. And each group had different culture practices. So my group had to bow before receiving, but the other group didn't understand what that meant. And anyways, it was a very interesting social experiment. And it was designed to put us in this like sort of like this discomfort, essentially. And after these events, and this was very early in my undergraduate career, they sent us home. And the only part of our experience that was being marked was our reflection on the event. And the reflection was very loose. It was like, reflect on your experience. And as a young undergraduate student who's been asked to give a reflection with no rules, no word limit, like no page limit, like none of it, I started with like, well, here's what happened, right? I was told I had to bow. I was told to not not speak in this language. I was told to try and win the game. And my reflection was really poor, right? Like looking back on it, I reflected very much on like what had happened to me in this. This was really not fun, right? Like I literally remember writing in my reflection, like, I didn't understand this activity and it was really weird and it wasn't that fun. Thank you for the free pizza, McMaster. And it put me, so this whole process was putting us on a journey of being able to do reflections well. And there was purpose, there was method to their madness, right? Repeating some of these same exercises 4 years later, our reflections were different, right? Our reflections were about my behaviors seemed to impact the other people that I was working with. My self-limiting beliefs around what had to be true here influenced my ability to achieve the outcomes I was looking for. I noticed that this reminded me of other experiences I've had, and I drew on those experiences to try and create success for myself. Over the 4 years of writing hundreds of reflections on the way we thought, the way we showed up in our community, the way we contributed to our peer groups, the way we thought about our own weaknesses, the way we tried to tackle those weaknesses, um, it evolved so much over the period of those 4 years because that like 80% of our grades were coming from these reflections, not from the actual activities themselves. So I share this little story because as we talk through the importance of this and why I think this is such a vital part of your health journey, I want you to know that this is not something that you are good at on day one, right? It's kind of like when we ask people to meditate and immediately they're like, oh, we're out of butter, right? You start to have thoughts that are irrelevant and are kind of like you doing meditation poorly. This idea of reflecting and having attribution for the things that you are doing and achieving or not achieving is not something that you will be good at right away. And yet we want to see this practice so that you can get to a place where this is a highly effective tool for you to self-coach and self-regulate when it comes to your health and health behaviors, right? So rather than saying, I ate broccoli and I didn't feel any better, right? Which would be my sort of first year equivalent of my reflection, getting to a point where you're saying, I'm proud of myself for eating the vegetables today, despite the fact that I know I'm not going to feel better tomorrow. However, I can see that the bigger picture of me committing to more fruits and vegetables in my diet is going to put me on a path to have the future health that I desire. That is a fourth year reflection, right? Or that was my graduating reflection. So why do we do this, right? And when I worked with patients, you are the person who is giving feedback in your health experience, right? Occasionally, or quite often actually, we look for like a sort of biometrics to validate how we are or aren't doing. We all want numbers. We all want lab tests. We're like, look inside and tell me if there's something wrong. And yet, the vast majority of communication that's happening in the healthcare space is subjective, right? We ask you how you are, and you tell us how you are. We ask you if you are getting better, and you tell us if you're getting better. And one of the biggest challenges we have in healthcare is that without reflection and without attribution, when we meet with a patient a second time, they can't see the improvement. They don't see their own wins. They have not achieved their goal because we're seeing them like 4 weeks later and nothing gets better in 4 weeks, unfortunately. And so, without this practice, this is both for practitioners and for patients. Without this practice being embedded in the healthcare journey, we're actually assuming that patients will notice all the changes without consciously paying attention to them, which is false. We're also hoping that the healthcare practitioner is going to ask all of the questions to dig up all of these new thoughts and feelings that patients are having in a short visit with them, right? And we're also kind of hoping that if we don't do this and we don't draw attention to this process, that patients feel so great the first time they come back that they keep their appointment, they keep going with the process, right? We make so many assumptions about what has to be true for them to keep going if we don't emphasize this and if we don't put some attention towards the importance of self-reflection. When I would start working with patients and I would ask them about self-reflection, and I admittedly at the beginning, I was like, I didn't intentionally write it down in their treatment plan, right? I would try and make them self-reflect in our time together, but I hadn't like asked them to self-reflect. And what I would get back would be like my first year level of reflection. Here's a list of the things that happened to me, right? That would be their reflection. Or they actually didn't they didn't pay attention and have anything to reflect on at all. I would say like, well, what did you notice? And this is, if you've worked with me in the past, I'm sorry, this is probably triggering. I would say, well, what did you notice in the last couple of weeks about X, right? About your energy, about your sleep, about your, and when I hadn't been intentional about why we were doing this or really calling it out as part of the process, what would my patients say, right? I would say, what did you notice? And they would say, well, what do you mean? What did I notice? I didn't notice anything. And like, to be fair, they probably didn't, right? Their energy probably wasn't that much better in 4 weeks. And yet here I am asking them to try and notice something. So I had to change my approach, right? To having people try and self-reflect in the moment, and under the stress of being in an appointment and trying to cover a lot of bases, it wasn't really the right time or place to ask them to do their first reflection on what was happening with their health. So I started to get much more intentional about it and embedded it actually in every interaction and in every instruction that they were having as part of their work with me. So if we were working on energy, I would say, here are some reflection questions I would like you to ponder until we see each other next. And I would write it right in their treatment plan. What do you notice about your energy from day to day? And I like that question, like, what did you notice? Because it actually lets them tell you what the most important things are for them, right? It tells you what, they find to be the most relevant. It tells you what is top of mind for them. And sometimes as clinicians, and we've all had this experience where you're treating a patient and you think you're doing what they want you to do and that you think that you're focusing on the most important thing, and then like the second or third visit in, they're like, actually the thing that's the most important to me is, and they say something that is not what you thought, right? Or something that was completely not even brought up. It's not on their intake form. It never came up in their first visit, but yet it's like the most important thing to them. We've all had that experience. Giving patients this freedom to reflect on what they've noticed about their health or what they're noticing can help you identify how to support and coach them, and also brings to light some of the things that they need support with or that they may find to be the most important, and yet that has not come up, right, up until now. But I would prompt them, and I would recommend doing this is prompting with like, what did you notice about the symptom? And then trying not to influence their reflections, I would verbally give them some ideas on what that might look like. Sometimes before we get better, we stop getting so much worse, right? So although we may not notice 10 out of 10 days, let's see if we can notice less 0 out of 10 days, right? Sometimes what we notice is that we still have moments where we're not that great, but those moments are shorter, right, than they were. So, if you in the past had hot flashes that were lasting, 45 to 90 seconds, maybe the frequency is the same, but the intensity is less. Maybe the frequency is a little less. I would prompt them and say, these are the kinds of things that you need to pay attention to, like intensity, frequency, duration, right? Of all the things, whether it's mood, whether it's your acne flare up, whether it's your hot flashes, and have them actually reflect on it, right? And trying to help them move beyond the like, what happened to me? Usually when we start reflecting on something, we feel out of control and we feel like the things that are showing up in our life are actually have nothing to do with us or nothing to do with our actions or our thoughts or our behaviors, right? Like, well, I went to a work function and they only served sandwiches, and so I had to eat the sandwiches. Like it's the work function's fault that you ate a sandwich, right? And I'm not saying sandwiches are bad. I'm just saying that's a very common example. I went here and they didn't have what I needed, and so I couldn't do my health behavior. That's a very common reflection at the beginning of your health journey. Reflecting on that deeper, right? And this is where and why reflection actually starts to create an opening for you, is to reflect on, well, how can I attribute to anything to the setup here? Can I make a connection for where I could have been differently involved in what was happening here to have a different outcome for myself? I didn't ask them what they were serving at the event, and I could have, right? I saw someone else scraping their tuna off of their gluten-containing bread, and I maybe could have taken that approach. I didn't, I've been to many, many, many of these lunch and learns before. I saw it coming, actually, if I'm being honest with myself, that they were probably going to serve this, and I could have still brought my own lunch, right? That kind of reflection takes a minute, right? It takes a certain level of vulnerability. It takes a certain level of commitment to uncovering the how come of what's happening in your day to day. How come this happened, right? How come I'm here? How come I'm here at the end of the day with my face in a bag full of Doritos and I haven't slept and I've had 19 cups of coffee? How come, right? How come I got here? And without that reflection, it feels like all of those things happened to you, right? And although sometimes I feel like my cup of coffee made me drink it, that is not what happened, right? That was a decision, a choice. And sometimes that decision is attributed to other previous decisions that, unless I do a great reflection, I would never be able to line that up. So, reflection, the purpose of it here is to try and help you get connected to what is happening in your life, but also how come, and the connection that you can make as a responsible individual to that behavior or to that outcome. Right? If we were the coach of the shot put athlete and they were like, "Yep, you know what? I woke up and I was horrible at shot put today and I didn't eat lunch, but there was nothing I could do." As their coach, we'd be like, well, no, you can eat your lunch, right? Like, we need to, if you want to be first, you got to take responsibility, right? If you want to be first, you got to take responsibility for your actions. You got to eat your lunch if you want to be a shot putter. And so coaching ourselves actually requires us to connect our behaviors with the outcome. The thing we want, which is like dangled way over here, the things we're doing and the how come we're doing them, and then coaching ourselves into like, well, what was my role in the thing that was done, right? What was my role in the thing that happened here so that I can move forward? And I'm going to talk about self-blame, just not right this second, because I don't want to lose my train of thought, but we're going to come back to it. So if you immediately went into the self-blame, oh, well, I didn't eat my lunch because I'm an idiot, right? You're just going to stop doing that. I'll address that in a second, because that is a trap. If we're talking about reflection, and for you, reflection means blame, that is a trap. And we're gonna stop that. But being able to connect up the behaviors that you're doing, that they are resulting in the way that you feel, and then looking ahead at the goal, which is like way over here, will help you actually be able to create sustainability and connection in your mind, that the actions you're doing are bringing you towards the goal. Okay. I don't know if this is you or not, but if you're a naturopathic doctor or an integrative practitioner who prides yourself on being evidence-based, but don't have time to stay up to date with the research yourself, I have a solution for you. I'd love to invite you to explore and join the Confident Clinician, the only integrative medicine clinical decision-making tool that helps get research from PubMed into your practice with ease. We have built out exactly what you need to be the most efficient in your work, to be the best in your community, and to save you those precious hours that you're spending right now doing the research yourself. Joining with our premium membership gives you access to unlimited AI searches, gives you access to all of our previous database content, as well as our upcoming year of live delivered modules. You can check out more in the link in the show notes. I would love to see you inside of our community. We're making a huge difference in the way that practitioners practice integrative care and raising the bar for evidence-based integrative medicine. I hope you'll join us. So what we mean by attribution is we want to basically connect a line that follows the journey that got you to where you are today. And attribution, and usually when I do this with anyone that I'm coaching, is we actually want to use attribution in a very positive way, right? So how did I get here, right? How did I get here? Who do I have to mentally thank? What risks did I take that got me to this point? What previous experiences, even if they were negative, built me into the woman I am today? This is what we want attribution to feel like. We use the term attribution in tech to describe how an action came to be. So, for example, when we are running ads for the Confident Clinician, we have some on Facebook, we have some on Instagram, and we want to be able to attribute how someone found us to those things, right? It makes sense because then we would put high investment into the thing, right? If you just keep clicking the Instagram ads, that's showing us that there is like a high attribution between us to like NDs discovering our work through Instagram. And so are going to put more investment towards that. We use attribution in business all the time very easily. How do we attribute the outcome that we're getting to our behaviors so that we can do more of those behaviors? The problem is if we never go backwards and draw those lines for ourselves, and in our health, it's so much less clear, right? It's not like you get a report from Meta, although maybe one day this is coming, maybe I don't think we want that, but maybe one day this is coming where Meta is going to send us a thing and it's going to be like, oh, the broccoli you ate like 6 weeks ago is why you feel so great today, Jordan. Right now, those lines are invisible and you are the one that actually needs to draw them. So I had 19 cups of coffee today because yesterday I didn't go to bed on time is an attribution line that you need to be able to draw for yourself so that you can be less likely to engage in the negative behavior again and more likely to engage in the positive behaviors again. And lots of the wearables are starting to do this for you. I'm a recent purchaser of a Whoop, and this is my second time of having a Whoop. And it just so beautifully told me about the impact of eating fruits and vegetables on my recovery. And it's drawing this like invisible line between a happy, healthy behavior and a happy, healthy outcome. But for most health behaviors, this is something that you actually have to do on your own, right? Or when you, again, like face first in the Doritos, asking yourself, well, what got me here, right? Like, what can I attribute this outcome to? And it may sound silly, but what we often will find is that it's linking us up to habits and behaviors that we have deprioritized or ones where we haven't made a strong connection for why they need to be there in the first place. Like, yes, I should go to bed early, but also I like scrolling. Scrolling in the moment gives you immediate gratification, but the late bedtime has an effect, and we can attribute the effects tomorrow and maybe even the day after to that bad sleep. But only if you draw that line for yourself would you ever consider going to bed earlier. So, if you're staring at your health plan, or if you're a practitioner and you feel like you're building this most beautiful health plan, but the connection to the actual actions feels really loose, or you don't feel super motivated to do them, the reflection and attribution has to be there. So, reflecting on how you feel when you did it, and then creating attribution between those behaviors and future outcomes or future ways that you feel, so that you can, when you're faced with decisions, again, because we are so much more likely to make a decision that makes us feel better immediately versus something that is about the future goal that's like off in the distance, right? But just like our athlete, they can't wake up and just decide they're first. They have to do a thing every single day for them to become first. You have to actually perform in that way as well. And when your goal is kind of like not clear and it's just like, I want to be healthier over here one day, it makes it very hard to show up for yourself. And so this idea of reflection and attribution is so important. So that's why you need to reflect. And I would say as you practice this, what you'll notice, and we're going to talk about a few little thought traps here before we wrap up for the day. As you're practicing those reflections, at its very basic level, just writing down what happened is really effective, right? We are literally thinking 5 minutes into the future and that's about it, right? We're not awesome at projecting goals, years into the future. We're generally thinking about the next couple of minutes, but even writing down what happened, right? Today I did this, I did this, I did this, this happened, this happened, this happened. Very basic, right? But it's better than not reflecting. So if you're at a place where you're not particularly emotionally connected to your health right now, even just writing down what happened can be quite valuable for you, right? Here's what happened today. It also lets you see where all your time goes, right? If it's like, here's what I did today. I sat in front of Zoom for 19 hours. Like, that's really helpful. It's a very good reflection because it can help you see that a large percentage of your day is spent sitting. The next reflection piece, though, as we want to start to move forward, is the like, how did this come to be, right? How did I get here? How can I attribute the things going on in my environment, in my day, in my choices that led me to get to this spot, right? Especially if it's a negative health behavior. If you're like, I skipped my walk again, right? What can we attribute to that outcome? Did you not set a hard boundary with your work call? Did you spontaneously decide to do something and lost track of what your actual goal was? Were you ill-equipped to go out when it was raining, right? These are all things that I want you to bring up as part of your reflection, because the moment we can do that, we can start to self-correct and strategize. In my next meeting, I need to be clearer that I have a hard stop for this walk. I can't get distracted by going to the mall with my kids because it's going to interfere with my walk. I need a raincoat, right? And then we start to have confidence that we can problem solve and make a different decision in the future. The other thing that reflection should help you be able to do is that reframe so that you can move forward, right? Well, here I am, like, I don't know why I'm picking on Doritos. I think because I got into, I haven't eaten Doritos in a long time, and I got into the cheese Doritos in the last couple of weeks, and so they're very top of mind. But here I am, in the Doritos. How can I reframe this going forward, right? Based on what I've learned in terms of my reflection and attribution, how can I move forward from this moment right now? Because sometimes when things that are happening to us are bad, and especially if we have a lot of shame and blame about that, there was nothing I could do. The Doritos came to me. There was nothing I could do. The Jays went into extra innings and I had to stay up late. There was nothing I could do. They didn't serve anything that I could eat at the work function. All of those are choices, right? All of those are choices. And so when you can get to this point of reflection, it's like, well, how can I move forward? How can I create solution and strategy for myself that moves forward? And I will say, and you're a patient and you come to an appointment and you say, here's what I noticed. Here's what I can attribute that to. And here's how I'm going to move forward. You'll win. You will win your health goal. You will, right? Because just like our shot putter who's like, I skipped breakfast. I felt exhausted in training. I realized that this is not going to get me towards my goal. You're doing the exact same thing, right? You're doing the exact same thing that we would expect that athlete to do. So as you start to reflect, right? Facts, right? Reflecting on the facts. Here's what happened factually. Great, right? That's great, but also I want you to do facts plus attribution, right? So facts, this is the fact, but what can I attribute to that fact, right? Like, how did I get to this fact? Yes, it may be a fact that they didn't serve anything that was on your health plan at the work function, but what can you attribute this outcome to? You not asking what they were serving, you not remembering the last 19 times you had a lunch and learn they served something you didn't want to eat, right? Like, you can attribute it to something, you can move forward from it in a much more positive way. If your reflection is feelings, that's okay. Here's how I felt, right? But also we want to take ownership. So I'm going to say if you do facts, let's do facts plus attribution. If you're reflecting and your reflection's full of feelings, I want you to try feelings plus ownership, right? I feel sad, but I'm going to own that I feel sad about missing my walk, because that actually helps you be able to reframe it for the future. It also helps you stay out of the two traps. And I would say in reflections, the two traps is self-blame and others blame. Okay, so it's the blame trap where when we're asking you to reflect and you didn't achieve something that you wanted to achieve, the purpose of it isn't so that you can feel bad about yourself. The purpose of it is so you can self-coach yourself out of it, right? Or to have a different outcome next time. We don't care about the past, right? We care reflecting about the past so we can change the future. Reflection is not to dwell. Reflection is to strategize, to take ownership, to see other possibilities. Because if you don't reflect, it makes it sound like there was nothing you could do, right? It makes it sound like there's nothing you could do. And so we don't want you to self-blame. But we also have to be really careful that we don't others blame. And that often comes up in reflections as well. Well, I couldn't do anything about it because my friend canceled on me and we were supposed to go to the gym together. Right? I couldn't do anything about this. This just happened to me. And there are lots of situations that will happen to you. It's your ability to take ownership in those moments that actually helps you hit your health goals in the future. We don't have a catastrophe happen every single day. There isn't a work luncheon every single day. They're infrequent, right? Those things are infrequent. But if you, as you're reflecting on them, can see what were the facts and the attributions, what are my feelings, okay? But also I'm going to own them. And I'm not going to self-blame or others blame, but I am going to use this as a way to propel myself forward. So it's amazing when I, would work with patients, how much their transition from this happened to me to like, this is just happening. This happened. And here's how I'm going to move forward with it was so amazing. And their ability to come in, visits later and say, okay, here's what I noticed. And they would start to notice the things that I was hoping they would notice, right? What was connected? Where's the attribution? Where could they take more ownership? Where did things happen out of the blue, right? They could evolve and they started to take more authority over their own health journey when they were committed to reflecting about it. So if you're a clinician and you feel frustrated that you feel like you're the agent of change in your patient's healthcare, it's probably because we're not asking them to be the agent of it, right? And asking them to do the behaviors that are required for them to be able to propel themselves forward. So reflection and attribution, regardless of what you're working on, adding this to your routine every day as you work towards your health goals can only help you take more authority and get better. So I hope you enjoyed the discussion today. I know it's a little bit of a different topic because we're mostly talking about like, how do you actually make the things work, right, that you're doing? And like I said, if we all felt instantly better from every positive health behavior we did, this conversation wouldn't be a thing. But what we're asking you to do is have perseverance in behavior with no feedback. So we have to create it, right? You're going to create the positive feedback for yourself by reflecting on what's happened. I'll see you guys next week. That's it for today's episode of the Real Integrative Medicine podcast. I hope you're feeling inspired, informed, and ready to make changes that truly support your health. If you found value in today's discussion, don't forget to hit subscribe, share this episode with someone who needs it, and leave a review. It helps us reach even more listeners just like you. Your health journey is personal and it's powerful. Let's keep building on the knowledge to give you the confidence you need to thrive. It's important to remember that the Real Integrative Medicine podcast is for educational purposes only. Be sure to talk to your doctor before making any personal health changes. This podcast isn't intended to diagnose you, and no doctor-patient relationship was formed by listening. We'll see you next week.